And now we're going to cover several bonus information, some questions and answers about heart disease in general, and also about some more issues regarding congestive heart failure. What about coenzyme Q10? So CoQ10, which is kind of our short name for it, it's a substance, a natural substance. We make it from scratch. Our bodies make it. It's a normal part of our energy metabolism. So anytime we move, our heart beats or whatever, CoQ10 is right there helping the energy get released and be turned into work, like pumping the blood, moving our muscles. The problem is CoQ10 levels can fall as a result of several things. So as we get older, our CoQ10 levels are lower. Disease, like heart failure itself, can result in lower levels. Our heart's working harder, using up more energy. Smoking, of course, is a really can decrease your CoQ10 levels. And medications. So medications can actually result in your body being unable to make as much CoQ10 levels as before. And the main example of this is statins. Any of your statin medicines that help lower cholesterol. The problem is statins interfere with one step in the pathway to making cholesterol. So that's why they're so great for lowering cholesterol. Your body doesn't make as much cholesterol. The problem is that little part of the manufacturing chain is also in the line to make CoQ10 levels. So at the same time it's decreasing the amount of cholesterol your body makes, it also interferes with your ability to make CoQ10 levels yourself. So because of that, there's been a lot of interest in CoQ10 supplements. So taking a supplement, since the body's not making as much, maybe it'd be helpful to take supplements to help things out. And CoQ10 levels are generally quite safe and have fair scientific evidence. So it's pretty fair evidence, not gold, not ironclad or anything, but some pretty fair scientific evidence that CoQ10 supplements may actually help people with heart failure. And how does it help them? Well, they found consistently fewer symptoms of heart failure, better exercise tolerance, so you can do exercise and handle it better, and better quality of life. And this is based on some very standardized questions about how are you feeling and how are you able to function and feel in life. And so CoQ10, coenzyme Q10 does seem to be helpful for that. CoQ10 levels may lower blood sugar and blood pressure. Those are usually good things, but not for everybody. Probably more problematic as it could interfere with the drug warfarin. CoQ10 levels is shaped a little bit like vitamin K, so it may kind of interfere with warfarin, or also called Coumadin, its ability to keep the blood thin and keep it from clotting. So that's something to be aware of. So bottom line, what is the controversy? The controversy is that there is enough evidence to say someone could take it. They could take it, they could benefit, but there's not enough evidence yet to say that everyone should take it. So you could take it, but it's not like you should take it. So if you do want to take it, discuss it with your doctor and get their advice and see if that's the right thing for you to do. So folate and vitamin B12. Folate is a B vitamin, as is, of course, vitamin B12. And for people with heart failure, there is actually fair evidence to suggest that taking folate and B12 supplements is beneficial for people with heart failure. And there's several benefits. It can help decrease blood pressure and homocysteine levels. Now, homocysteine is a chemical that can damage blood vessels. And normally, if your body has enough B vitamins, you break down homocysteine, it doesn't stay around very long. But if you don't have enough B vitamins to break it down, then the homocysteine doesn't get broke down. It kind of hangs around, builds up, and kind of tears into your blood vessels. It kind of causes trouble because it's not getting broken down and processed like it should. Also, these B vitamins tend to improve heart function. And so basically the heart is beating better and beating out more volume as it should. And also, again, improve quality of life scores. Again, these are standardized questions to see how people are functioning and feeling in their life. And they found that people were feeling and functioning better when they have these B vitamins. So how much? Well, it can be quite a bit. For folate or folic acid, 800 micrograms to 5,000 micrograms a day. Pretty much when you get to 1,000 or more, you actually need a prescription to get that much. B12, 200 to 500 micrograms a day. And these are the ranges of amounts that have been found and studied to have the benefits that we discussed above. And this was all put together by the American Dietetic Association Evidence Analysis Library. It's a standardized systematic review of all the evidence to see, is there a benefit and how much of a benefit is there, and how sure are we that there is a benefit. So diuretics and vitamin B1. This is another B vitamin. It's also called thiamin. Now, it's a controversial issue, and that's simply because of the research. It's not B1 itself is extremely safe. They've been unable to find even a level of B1 that's harmful. So, hundreds of times, literally hundreds of times higher than your basic amount that you need, apparently has no bad effects at all. And why would it be needed? Well, when you're on diuretics like Lasix, you you lose a lot of B1 in your urine. And being too low in thiamine or B1 by itself makes the heart work harder. That's not good, especially if you have heart failure and your heart is already working too hard. However, it's the controversy is like, well, wait a minute. There's hardly anybody in the U.S. that's low in B1. Um, so, and most people have enough, but it is possible if you're on the super high doses of Lasix that you may need some. Also, if you drink alcohol, you're more at risk for being low in B1, especially if you drink alcohol in excess. So, so bottom line is, it won't hurt, it might help. Magnesium. Now, magnesium is involved in every place in your body that uses energy, and and it's also very important to the heart. And research suggests, very fair evidence, grade 2, that's fair evidence, that magnesium supplement pills in patients with heart failure may reduce a lot of things that go wrong. So problems with ventricular ectopic beats, couplets, episodes of nonspecific ventricular tachycardia, or premature ventricular contractions. These all have to do with how a section of your heart beats and how if it beats regularly or irregularly, or it does things in the proper sequence. So basically this is saying that magnesium seems to help the heart beat like it should, is the bottom line. And this is also evidence from the American Dietetic Association Evidence Analysis Library, where they systematically reviewed the research and said, what can we confidently say, and how confidently can we say this about a benefit of magnesium pills? Some general information. You want to separate magnesium pills from other pills by about 2 hours before and after. And that's because magnesium likes to kind of bind to a lot of things. And so because it can bind to so many things, it can interfere with the absorption of other medications you may be taking. Now, it doesn't bind with everything, but it binds with enough things. So just as a general precaution, just kind of separate it by an hour or so. Also, kind of a minor caution is excess magnesium can cause loose stools, so you don't want to take much more than 350 milligrams from supplements a day, or you'll get loose stools. Now, that may be beneficial if you have problems with constipation, but just something to be aware of. So what about vitamin D? Vitamin D, you can't hardly watch TV or go on the internet or open a magazine without seeing something about vitamin D. Well, vitamin D is important, and there are a lot of people that are low. It depends on which research you look at, but some find up to 80% of people are low in vitamin D. And the way you find out is you get a blood test. The blood test is called 25-hydroxyvitamin D, and you need to get that from your doctor, your clinic. Vitamin D might be important for heart health because it supports the strength of the muscle, including your heart muscle. So it may be valuable for those with congestive heart failure for that reason. And we also know that vitamin D is important for glucose and blood pressure, blood sugar, blood pressure. And so that may also tie into its importance for the heart. However, high doses of vitamin D can cause irregular heartbeats in people taking digitalis, also called digoxin, and this is important heart medicine. So while vitamin D, it's like anything, it's a balance issue. While it's bad if you're too low, it can be bad if you're too high as well. So in general, rule of thumb is you shouldn't take over 2,000 IUs. That stands for international units. That's also, we could say that's 500% daily value. So when you're looking at a supplement that's over 500% daily value, you probably shouldn't take that unless by a doctor's prescription or advice.